Hello and welcome everyone. My name is Molly McCracken. I'm the Manitoba Director at the Canadian Centre for Policy Alternatives. The CCPA is Canada's leading progressive research institute. We are an independent charitable public policy institute. And I see some familiar faces and some new faces. So thank you so much for joining us here today for COVID-19, austerity, and an alternative social and economic path for Manitoba. And here at CCPA, we're very lucky to have many wonderful research associates that produce research that reaffirms that our best values are possible. So this paper that was just launched last week by Jessie Hajer and Lynne Fernandez, upon which this talk is based, is about that, about showing a path forward, giving us hope, and also grounding us in a good analysis of where we've come from and our current situation. We're broadcasting here today from Treaty 1 territory, the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people, and the homeland of the Métis Nation. The hydroelectricity that's powering our computers here is generated in northern Manitoba and Treaty 5 territory, and the water that sustains us here comes from Treaty 3 territory. And we recognize that, of course, truth and reconciliation is key to a just recovery from COVID-19, and that is, of course, central to our work here at CCPA as well. The talk that Jessie and Lynne are going to be giving is based on a report that was launched last week of the same title, and we'll put that in the chat for you if you have a chance to read it. It's got excellent analysis and goes into a lot of important information of what they will be talking about and what we've been going through here. So yeah, I'm going to introduce our speakers momentarily. They are going to speak for about 25-30 minutes, and then we will have some time for questions and discussion afterwards. And if you have questions along the way, feel free to put those in the chat, although we won't pull the questions from the chat until the very end as well, and I'll go over how to ask the questions again at the very end. So I'm very pleased to introduce our co-speakers here today. Jessie Hajer is a faculty member in the Department of Economics and Labor Studies program at the University of Manitoba. He's a research associate with CCPA Manitoba, and he was a policy advisor and project manager with the Government of Manitoba from 2009 to 2016. And Lynne Fernandez recently retired as the Errol Black Chair in Labor Issues from our office. We miss her very much. And she is a research associate with our office and co-leads the education, training, and social inclusion stream at the Manitoba Research Alliance. So yeah, I'll just hand it over to you, Jessie and Lynne, to begin. Thanks so much for doing this with us today.
Thank you, Molly. Thanks for hosting us today. And thank you to the Department of Economics and Society Stream and Labor Studies program for co-sponsoring the event today. There's two main things that Lynne and I try to accomplish in this report. The first is to put forward a number of policy alternatives to austerity, looking at a just recovery in Manitoba that addresses the unequally distributed social and economic harm of the pandemic. And our focus is primarily on a provincial government policy. The second thing we're trying to accomplish in this report is to document what has happened and how it influences the different paths that we can take going forward, and how it's shaped our response and options at this point in time. The Manitoba government was exceptionally conservative in its initial social and economic response to COVID-19. This was consistent with its pre-COVID-19 course that was aimed at constraining the size of government. We suggest in our report that this austerity bias ultimately hindered the ability of the government to effectively respond and continues to impact our trajectory today. We know that history matters, but it doesn't necessarily bind us. Even this government has flip-flopped on its approach multiple times during the pandemic. And we suggest that a public engagement process that's representative of public opinion would lead to a more progressive approach that invests in the people of Manitoba. So what I want to do to start off is just to briefly define what we mean by austerity. So austerity is an approach to government, to governing, that is centered on lowering deficits and debt. We see that proponents usually emphasize one particular way of doing this. It's by expenditure cuts. Higher taxes are often are an option to reduce deficits, but that is usually not advocated for in practice by pro-austerity governments. In fact, they often pursue tax cuts at the same time. So austerity is focused on usually some indicator of the debt or deficit related to the size of the economy, usually GDP. And the tax cuts are often, tax increases are often avoided because of assumptions that tax increases will hurt economic growth, or it will hurt business or consumer confidence. But as I noted, in practice, pro-austerity governments and their backers generally pursue tax cuts, and this creates somewhat of a vicious cycle. So premature tax cuts and the lost revenue can lead to structural deficits and then be used in the future to rationalize further spending cuts, which can fuel a whole new round of austerity. So even austerity on its own terms, when we're just looking at expenditure reductions, can be self-defeating, and it can hurt the economy. It can reduce the demand for goods and services, and then in turn reduce economic activity. When we're in a recession like we're currently in, where demand is already low, this reduction could potentially create another type of negative feedback loop, and we have additional job losses taking place and further falling demand. We also know that cuts to government investments in infrastructure, health, and education can hinder our productive capacity in the long run. And then this self-defeating phenomenon can arise where we can have GDP falling proportionally more than government debt, and then we end up with an overall increase in the public debt burden. So that's the worst case scenario of an austerity approach gone quite bad. If this is likely or possible, why would austerity be pursued? Well, there's different ideas out there, but one thing that's fairly clear is that austerity weakens the bargaining power of workers, and it reinforces the leverage of employers and those who hold large amounts of wealth in society. So austerity can be used as a guise for cutting government programs that may not be preferred by whoever's in power or for ideological reasons. What we've seen more recently is a reversal of austerity being the dominant approach. Austerity was very mainstream in the 1980s to the 2000s. There was a very powerful anti-government movement that argued that we needed to reduce the size of government. But more recently, economists and even conservative international organizations like the IMF are increasingly advising against austerity because of these negative impacts. Okay, so in Manitoba, we have seen since 2016 the PC government with a fiscal focus on austerity with the goal of constraining public expenditures. The Progressive Conservatives instituted a rapid constriction on government spending growth, and this was accomplished through budgeting very modest increases, often increases below inflation, but then underspending significantly within each year. So on the healthcare front, for example, we saw spending fall approximately 3% in inflation adjusted terms between 2016 and 2018. Infrastructure spending was also rapidly curtailed, and this was based on a similar strategy of underspending. What has happened then at the total budget level is that we've seen expenditures as a proportion of GDP falling. It's fallen to the lowest level it's been at in the last 15 years or so. We have also seen that recent tax cuts by the Pallister government have also reinforced a decline in revenues. So on the graph here, I have both revenues and expenditure as a proportion of GDP, so in relation to the size of the economy. So tax revenues these are overall revenues, including tax revenues, have fallen from approximately 25% in the mid-late 2000s to approximately 23% in the late 2010s. And this recent decrease that we see here is happening despite a significant increase in federal transfer payments. Now, we also have the government committing to further tax reductions, including the elimination of the school property tax, which is an important source and large source of revenues, without any plans to replace that loss. So we're likely to see that trend continue if the government pursues its pre-COVID agenda, which we'll find out shortly with the budget being tabled. Now, austerity in healthcare is particularly relevant to the current situation, given the pandemic. There have been concerns raised that the healthcare cuts that took place over a number of years have reduced the capacity of Manitoba's healthcare system to respond to the current crisis. There were a number of cuts that were implemented as part of Manitoba's health system transformation strategy. In 2017, there were 15% cuts in management staffing in healthcare, including in addiction services, despite the opioid and methamphetamine crisis. This resulted in over 200 positions being cut. We saw the closure of 3 of 6 emergency rooms. Some of those converted to urgent care, a net gain of 1 urgent care center. Overall, the WRHA, the Winnipeg Regional Health Authority, was given direction to find $83 million in cuts in 2017. And there were a number of other cuts that were implemented with respect to specialist targeted programs for mothers and women seniors, rural emergency medical stations, and the privatization of some services as well, such as physiotherapy and the contracting out of home care services. We've also seen further administrative reductions launched in 2018 with projected reductions of $60 to $200 million in those years. Fast forward to 2019, and Dr. David Peachy, whose consultant report was the impetus for this change, came out with some pretty discouraging results with respect to what had taken place. So speaking to the state of affairs with the healthcare transformation strategy, Dr. David Peachy noted in his follow-up report a shortage of readily available emergency department beds, leading to a stack up of patients, longer wait times, and lengths of stay. Peachy noted that workload and staffing instability were significant and not sustainable, and remarked on a deep-seated unhappiness in emergency department nurses and physicians. Nurses were facing, quote, unknown levels of stress, exacerbated by a mixture of unpredictability and under-resourcing due to the amalgamations. And Peachy's report recommended that the consolidation should be paused immediately while the underpinning process undergoes repair and restores activities. So in Manitoba, some have blamed this austerity in healthcare for Manitoba's ultimately poor performance when it came to grappling with the impact of COVID-19. So in particular, we had our nation-leading infection rates in the second wave, the multiple devastating outbreaks in personal care homes and in other healthcare settings as well, and bottlenecks in testing capacity during the fall of 2000. There were a number of other pre-COVID-19 austerity examples that took place outside of the healthcare system. There were aggressive reduction targets, which were applied to the broader civil service and crown corporations, with the government eliminating approximately 2,500 positions between 2016 and 2020 in the civil service. This was nearly a 20% reduction in the civil service workforce. On top of this, we have very high vacancy rates. In the March of 2020, it was reported that the Department of Families, based on a Freedom of Information request, had a vacancy rate of nearly 25% in the department. Crown corporations were also given multiple 15% management reduction targets, and these took place regardless of the specific services being delivered or whether the programs were being offered efficiency. It was a simple across-the-board directive. The government simultaneously implemented a wage freeze that further hindered the public sector and led to real wage reductions. We've also seen infrastructure spending undergo a rapid contraction relative to the previous government, with all the associated negative economic impacts that we would expect. And this has likely contributed to Manitoba's declining economic performance relative to the nation as a whole. We also saw education expenditures either frozen or below inflation increases, depending on the particular level. In the area of housing supports, there's been reductions to the rent assist benefit, cuts to public housing maintenance and repair budgets. There's an active ongoing effort to sell off and devolve public housing. We saw supports for seniors being downloaded and downsized. Many nonprofit organizations have seen their grant funding reduced, including women's centers and neighborhood renewal corporations. And we also saw the Neighborhoods Alive program being eliminated, with funding spread out across the entire province instead of being focused on low-income communities. So these austerity measures have been pointed to, along with the associated reduction in public services, as disproportionately burdening those who are most in need of support, particularly those who have most negatively been impacted by the crisis. It's left, according to community agencies, the broader service providing community weakened in the lead up to the crisis. There's also been a number of academics and public policy experts that have suggested that the provincial cuts and the austerity approach has hindered the ability of Manitoba to respond more broadly, not just in healthcare, but the broader public service to the health crisis and the evolving economic crisis. Okay, sorry, Lynn, I think I stole your thunder there. I'm going to hand it over to Lynn, who's going to jump in here.
Not at all. Thank you, Jesse, for setting this up. All the points that Jesse has just made probably, or no doubt, contributed to the rapid contraction of provincial government spending, and which unsurprisingly would coincided with falling economic growth and job market performance in Manitoba relative to Canada, as Jesse said, as a whole. So Manitoba's economy, measured in real terms per year, grew approximately 0.5 percentage point more than Canada's when we look at the period between 2012 and 2016. But from 2017 to 2019, Manitoba's annual growth was actually 0.7 percent points below national levels. And that's when we saw our historic advantage in unemployment rates disappear between 2016 and 2019. And that's what we see in this graph here. The blue line showing what the unemployment rate, how it's varied between 1999 and 2019 relative to Manitoba's. You can see our black line there was consistently lower than Canada's as a whole. But as we get into 2019, those rates join together, showing that we've lost that historic advantage that we had. Our unemployment rate actually at one point is a bit higher than the rest of the countries. The next graph shows the employment rate for that same period, and advantages in the employment rate have also narrowed. And despite Manitoba's relatively young population, we continue to see this downward trend in the employment rate since 2017. And Manitoba and Canada have been moving in opposite directions. So once again, that black line is Manitoba, and that's the employment rate. So the percentage of the population that's employed, a percentage of the working population that's employed over 15 years of age, and the blue line being Canada. And as you can see, those are coming together, which is showing us that we're losing that historic advantage in the employment rate. This next graph is showing the employment rate changes just for Manitoba. And what's interesting here is if you look, it's a bit messy to read this graph, but you can see what the big drop was in employment when COVID hit. So in February of 2020, our 63.5% of our working population was employed, and that plummeted down to 54.8% by April of 2020. And then there's a little indicator there which shows that as of January 2021, we have come back up to just over 60%. I think it's gone up a bit. Jesse tells me it's gone up a bit again in February, but we don't, these are the most current figures that we have. So the point of this graph is to show just how much employment plummeted because of COVID. And of course, this would be the same across the country. There's, we weren't necessarily any worse in that, in the amount that we dropped. But it also shows that as of January, we still have not come back to our pre-COVID levels. So we are still definitely in a recession. This is the same story if we look at the unemployment rate, which went very high, up to 11.3% April 2020, and then it went back down again. But as of January 2021, we're still at, and I'm trying to read this graph, Jesse, 8%. And so we have still, we've done a lot better, but in February 2020, we were 5.1%. So our unemployment rate is getting better, but it's still considerably lower than, considerably higher, than it was pre-COVID. So once again, this was just to show you how dramatic the hit to the labor market was when COVID hit us, but it would have been the same, well, not just in Canada, but around the world. But it does give you an indication of how much things have changed and that we're still not recovered yet. The next graph kind of gets a bit more granular, and it shows jobs hours lost according to income, according to how much people are making. And the social impact of the economic decline is magnified by its unequal distribution. And low-wage, precarious workers have borne the brunt of the job losses, with women and non-unionized workers and small business owners disproportionately losing their livelihoods. It's also important to note that the lower income workers are disproportionately racialized as well as women. So white collar and higher income workers who are more able to work from home have not seen their incomes change nearly as much, if at all. And precarious and racialized workers are definitely overrepresented, as I said, in these frontline jobs, which are ironically deemed essential, and face, although they face elevated risks and stress associated with working through the pandemic. COVID-19 has disproportionately, as I said, impacted racialized communities whose members are facing increased discrimination during the pandemic. So if we look at this graph, the recovery from the worst of COVID-19 job and hour losses has been very uneven. While the top quarter of earners were better off in December than they were in February, the bottom half of workers, and those would be those making under $17 an hour, have hit a plateau. So there are still 14% fewer people earning less than $17 an hour today than in February. And that seems like it's the best it's going to get for some time for low wage workers. So you can see that red line representing the lower wage workers went way down and has come back up and plateaued. And if you contrast that to the top line, the sort of green line, which is the 35 an hour and higher, their income was not, and jobs worked was not impacted very much at all. And it's actually even gone up. So that shows us the difference between, or the disparity in labor market between precariously employed or so-called essential workers versus the higher income. So that's it for the labor market stuff. And I'm going to pass it back to Jesse now, who's going to talk some more about the health response in Manitoba.
Thanks, Lynne. Now I'm going to go through what we constructed as 3 different stages of how the province responded to the COVID-19 crisis. I'm going to focus later on the economic and social supports, but I want to start off here with the health response in Manitoba. So Manitoba did take a fairly aggressive response to the public health crisis. They shut down the economy early, declaring a state of emergency on March 20th. And through a series of public health orders and aggressive and proactive steps, basically things were shut down before community transmission was really established. We also saw some large commitments announced early by the government of Manitoba to support various health-related expenditures. This included $400 million for personal protective equipment and other medical supplies in early April. And later on, there were announcements throughout the various stages where commitment with healthcare was generally fairly robust. There were some criticisms. There was an avoidance of expanding the public sector and nonprofit sector workforce, who arguably were better positioned to respond. Instead, what we saw was a reliance on for-profit contracting out. So for example, relying on the Manitoba Chamber of Commerce to address childcare needs through the business community, as opposed to the network of nonprofit regulated service providers. Overall, though, Manitobans were generally supportive of the aggressive public health approach that was taken by the provincial government in the first wave. And overall, there have been some recent analyses that suggest Manitoba is covering the highest percentage of COVID-19 health expenditures of any province. Although Molly will note that there's still some questions remaining on that. On the social and economic side, however, there was a very different approach pursued, particularly in the early phases of the pandemic. So in those early phases, parallel to the announcement of all these healthcare spending measures, the government was pursuing a very aggressive and renewed austerity agenda in the non-healthcare related areas of government. There was a call on the broader public sector to engage in some unprecedented cuts, and supposedly these cuts were to free up resources to divert towards healthcare. In April 2020, the government asked the broader public sector to come up with $500 million in cuts to labor costs. This was on top of another $750 million of targeted expenditure reductions within the provincial government itself. This included across-the-board cuts of 10% to provincially funded nonprofits, and that were deemed non-essential, which meant non-healthcare related for the most part. Part of the strategy that was proposed involved laying off public sector workers for 2 to 3 days per week for 4 months in the middle of this crisis, and trying to get the federal government to partially compensate these workers, which never did pan out. This austerity approach that was pursued by the Pallister government early in the pandemic was quite unique on the national stage. Perhaps Alberta's Jason Kenney, Premier Kenney, had a somewhat similar share the pain agenda with aiming at cuts, but for the most part, provinces recognized the importance of maintaining government expenditure in such a deep downturn. The approach of the Pallister government was broadly criticized as being counter to standard economic theory. It was predicted it would exacerbate the economic crisis and work against the efforts that were quite extraordinary being taken at the federal level to support incomes and maintain employment during the crisis. You quite literally had the federal government paying employers to keep people on the payroll while the province was saying it was going to lay off workers. More generally, what we saw was the province in the first month or so after the crisis was clearly present, providing only minimal supports to households and businesses, basically vacating the policy space to the federal government. This was despite many options available to the provincial government to bolster income supports, support employment, and help businesses navigate the crisis. What I have up here is a table comparing the response of Manitoba to the British Columbia government, which has been held up as one of the more progressive approaches, the more proactive approaches to the crisis, particularly in the early stages. And what we see here, I'll just highlight a few out of this table. Obviously, this is available in full in the report. You had BC providing a rental supplement to renters, where Manitoba had no additional income supports for renters provided. BC also provided reductions in hydro rates as well as some credits for targeted households that had lost income because of COVID-19. Manitoba was only willing to waive late fees and, like BC, stop disconnecting people who couldn't pay their bills due to lack of income. BC also had a top up to the Canada Emergency Response Benefit, where Manitoba provided no such top up. We also had income assistance recipients in Manitoba having that CERB benefit clawed back instead of the alternative, which BC pursued, which allowed those in the social assistance system to keep their benefit. So it's not like there wasn't other options out there. Other provinces were doing things differently. Manitoba chose a very conservative approach. Now, there was some backtracking on this very aggressive austerity agenda. Eventually, there were additional announced supports for some households and businesses and the broader economy. Lynn and I document those in detail in the report, and they total up to over $1 billion in what we could find to be unbudgeted COVID-related spending. So this included $310 million for business, $186 million for households, and just under $6 million for the broader economy. A big chunk of that being a $500 million commitment to physical infrastructure investment. So what this shows is that there was a reversal of sorts. After the early months of the pandemic, the province did ease up, and at least it did so in its public-facing communications. We have these new spending commitments, and by the time we get to the end of June with the 2020 fiscal and economic update, we have a complete rhetorical reversal of the government, moving away from these claims that the deficit and the debt are the issue that we need to tackle, that we need to be considering, and basically no reference to the size of the deficit in this update, instead emphasizing the high level of pandemic response spending in Manitoba. The Premier was quoted as, growing our way out of this pandemic financial hole is the only way forward, which you can't get closer to a full 180 than that. But despite this, there were still criticisms of this period, of this approach, regarding the programs that were launched and whether they were truly available to those who needed them. There were very narrow eligibility criteria, which led to a lack of uptake, particularly for the business support and wage subsidy programs. And this was consistent with the governing approach before the crisis when it came to austerity. Budget some money, but don't end up spending it. The few income supports that did come, they came after prolonged criticism of the government's lack of action. And depending on which one we're talking about, they were either criticized as poorly targeted and politically motivated, such as the check to every senior in Manitoba, or being too narrow. So the disability benefit was only for people on social assistance and no support for the broader population of people who needed support. Moving into the summer and the spring season, Manitoba pursued a very bold reopening strategy. Manitoba, the Premier stated his goal of being the first economy to reopen, and succeeded, or was tied for that a goal. And public health restrictions were loosened quite quickly. Over the summer months, there was basically a mission accomplished banner laid out. Manitoba appeared satisfied that the worst of the pandemic had passed. There was a campaign launched to attract tourists to Manitoba in July. 1 week later, the province announced $2.5 million to promote Winnipeg as the CFL hub city for the eventually canceled 2020-2021 season. And then in August, the province launched the Restart Manitoba advertising campaign with just under $500,000 budget to restart our economy and reopen our communities. Throughout the summer, the government had also shut down the COVID-19 response center. Testing centers were also shut down. Operating hours were reduced. And when the fall wave arrived, which was widely predicted, the lack of testing capacity in September led to half-day-long waiting lines at testing stations, as well as other challenges. And that shortage of testing capacity persisted for at least a month, despite federal aid being available and government funds and personnel being offered from the federal government. We also had contact tracing being significantly delayed, which further undermined the pandemic mitigation strategy. So what we saw in Manitoba then was a increase in rates that brought Manitoba from being one of the lowest COVID jurisdictions to having one of the highest infection rates. So in September, it jumped from being 10 in April to 248 over that 3-month period. And we gained the undistinguished title of the highest new infection rate in Canada. So it wasn't actually until doctors wrote a public letter to the health minister that the November lockdown eventually was imposed, and the doctors there were noting that it was almost too late at this point, that the lockdown should have occurred much earlier based on infection tracking data. And it was, as in the first wave, vulnerable populations again who were the most greatly impacted. The province saw dozens of outbreaks in institutional settings. First Nations and Indigenous Manitobans were disproportionately impacted in the second wave, along with the precarious workers that Lynne talked about earlier. We saw multiple outbreaks in personal care homes and a series of deaths being announced on a near daily basis. Many of us are sadly very familiar with these tragic events. Shortly after the lockdown was initiated, 200 doctors and academic health experts released a letter that highlighted that it was government underspending and fiscal constraints that were hindering the ability of the healthcare system to respond. So again, it was this austerity bias, according to these doctors, that had led to this constraint on testing capacity and hindered the ability of the healthcare system to stop the spread of the virus. Now, what we want to do now is move on to alternatives to austerity. So I'm going to pass it back to Lynne, who's going to kick us off here.
Thanks, Jesse. Yeah, this was where we get into the more hopeful part, or the more encouraging part of the presentation, assuming that somebody actually listens to us. Several progressive public policy experts and organizations in Canada have recognized the potential of the COVID pandemic as a turning point, an opportunity to reverse decades of growing inequality, inaction on climate change, and underinvestment in public social services. So the federal government response to the crisis has shown that when there is a political will, along with parliamentary and popular pressure, resources can certainly be mobilized. And although the potential for this to be done in a permanent programmatic way has yet to be realized, but we have to recognize that the federal government has done a pretty amazing job of responding. There is a growing movement recognizing that the economic recovery response needs to move beyond conventional short-term counter-recessionary stimulus packages that are focused on hard infrastructure to a long-term strategy that also invests in people. And we can cite, for example, a letter from 105 economists, including people like Jeffrey Sachs and Joseph Stiglitz and Mariana Mazzucato and Robert Reich. And just a quick quote, a part of their letter is, as the present moment painfully underscores the weaknesses of our economic system, it also gives us the rare opportunity to reimagine it. As we seek to rebuild our world, we can and must end the carbon economy. And then they talk about the present moment creating an opportunity to bring about a better future for ourselves and our children. And by taking on the carbon economy, we can begin charting a pathway towards economic recovery while building a fairer, more sustainable world in the process. We also need to, sorry, I've lost myself here. Want to talk about some Manitoba-specific policy proposals that could be implemented quickly. Sorry, I've missed a slide. Sorry about that. Why we need to build a socioeconomic response. Despite the slow reopening of the economy, businesses and jobs are not likely to simply recover to previous levels. And predictions of a third wave are already being articulated by medical professionals, and we've already seen that happen in Ontario and BC and Alberta. Despite rapid federal government intervention to mitigate the economic damage, high levels of unemployment persist, and we saw that in previous graphs that we looked at. The pandemic will likely have negative effects on the economy long after the pandemic has passed, and long-term economic restructuring is already taking place. For example, the adoption of labor replacing technology that has been accelerated during the crisis is disproportionately impacting lower skilled, low wage, racialized workers. We saw that, we talked about that earlier. So this labor displacement and unemployment are clearly damaging, with the burden on those least able to cope. So these unemployed and displaced workers are actually an underutilized resource, and there is no requirement that they return to the same type of employment once the crisis ends. So we need to grab that idea and think, okay, how can we retool the economy to accommodate them? And they could be incentivized and retrained and reemployed to deliver inequality reducing and well-being enhancing public services and climate change mitigation programs. And this will require an additional level of bold government intervention to coordinate all the relevant stakeholders towards a green and economic recovery at a level we have not yet seen at the federal level. So we need the provinces to start kicking in too. And we need for these social investments in Manitoba, or I should say the need for these social investments in Manitoba was high before the pandemic, magnified the underlying socioeconomic inequities. And it has been low wage racialized workers and women who are overrepresented in caring, service, and part-time work who've lost their jobs. So we need a bold response, and a very much looking forward to seeing what we're going to see in tomorrow's budget to see if we have that kind of a response coming forward. But given the way that they've responded up until now, it's questionable whether we're going to see the response that we need. I'm jumping ahead here because I'm aware that we're kind of eating up a lot of time. And if we look at some Manitoba-specific policy proposals, there are measures that could be implemented quickly. They include pandemic public health response and worker safety, and investment in public and community health and well-being workforce. And where the province's communications and enforcement strategy has focused almost exclusively on community and household transmission, despite the large proportion of cases arising in workplaces. So we need to think about how we could fix that. The shift would include recognizing that COVID can be transmitted through aerial socialization, and based on this, undertaking measures under provincial jurisdiction, including designing and enforcing new workplace health and safety standards. And we also need to reverse the cuts to health and safety enforcement and hiring additional workers, and upgrading workplace PPE and ventilation, prioritizing essential service workplace systems and equipment upgrades in schools and personal care homes, and enforcing and supporting the right to refuse safe work. We need legislated mandatory access to paid work days. This is crucial. Presumptive coverage under workers' compensation insurance, as has been done in British Columbia, would be another good idea. And we need to take measures so employers cannot practice claim suppression when workers are injured or fall ill on the job, and they need to file a claim with workers' compensation. And we need to ensure that all residents, particularly temporary foreign workers and undocumented workers, have Manitoba health coverage and are not prevented from employees from accessing it. And I'm going to jump ahead to the strategic recovery measures. And a lot of these were highlighted in our alternative provincial budget that we put out in 2019, and that there's still a lot of really good ideas in that. But we need to expand universal health services, look at funding more social and affordable housing. That's super important. Public universal childcare, restoring and supporting public education, skills and training, democratic economic institutions, and support for community development and advancing truth and reconciliation. And all those ideas and more are in our alternative provincial budget as well. I'm aware that we're running out of time, and so Jesse, do you want to take it back over here and quickly go through this? I want to hopefully leave some time for a few questions. So
thanks, Lynne. Yeah, just brief there on not just in a generic fashion, but targeted at the groups that have been most impacted by the crisis. But the questions, just as important question is how are we going to pay for such an agenda? I think there's a real opportunity here with the federal government being very clear that they're going to be pursuing an aggressive stimulus package. And that often leads to a lot of flexibility with how those dollars are spent. For example, the provincial government could just as easily fund a universal public childcare system that creates good unionized jobs with high quality early childhood educators, or it can promote private childcare through the Manitoba Chamber of Commerce. And that's what it's currently doing with federal funding. And there'll be many other examples such as this, where there'll be federal funding available to pursue a recovery with provincial discretion on how to do that. We also are in a situation where interest rates are at record lows. We can deficit finance for decades at this point at very low interest rates. It's not that we don't have to be careful on how we manage our money, but we need to look at what are the costs associated with not addressing these social issues. Early childhood development is one of those areas where experts across the spectrum agree that high quality childcare pays itself back many times over to governments, and we need to act on that academic research. We could also be looking at some new provincial revenues, and as Lynne mentioned, our alternative budget goes through a number of options, not just on the spending side, but also on the revenue raising side. Manitoba overall is not anywhere close to being one of the highest tax provinces. And so I think we agree there's some room to move on that. And there's also some areas where spending could be reallocated. Government has been cut quite deeply, so I don't think there's a lot of easy low-hanging fruit, but the justice system and over-incarceration has been identified as an area where money could be saved through alternative approaches. Now, I don't think any of this is going to happen without broader engagement of labor and civil society organizations. The current government has taken steps based on our research to reduce who is participating. So for example, on the Economic Advisory Council for the Premier, it's now only business owners instead of business and labor and community representatives. I think an alternative strategy should be adopted. We need a broad approach that would include engagement with the many different stakeholders in Manitoba society, not just the private for-profit business sector. So I'm going to wrap it up there. Thank you very much for your patience and listening to us speak today. We're happy to take any questions.
Thank you so much, Jesse Hajer and Lynne Fernandez, for your presentation and for all of your work on this report. It's so important to have this, particularly today before the Manitoba budget drops tomorrow, and then also looking forward and as a historical document. So really, really appreciate all of your time and attention on this today.